The COVID-19 pandemic has presented major risks to the health and well-being of islanders. Those risks are still present. Yet, it's only when you stop to look back that you realise the magnitude of what we've achieved in such a short space of time. To best protect islanders, the government worked with external agencies and partners to develop and implement an island-wide pandemic public health strategy. This strategy has been continuously updated to meet evolving circumstances and greater knowledge of the virus. It has allowed for several new initiatives to be set up to preserve life, promote health and hygiene, and support the highest risk and vulnerable islanders. The Urgent Treatment Centre and GP Partnership, for example, the Nightingale Wing, which was built in less than 4 weeks, and the creation of a second station for our ambulance service in partnership with St John Ambulance. We delivered a community street triage as part of the Mental Health Crisis Prevention Service and established a safeguarding cell with 15 key agencies to address mental health and other safeguarding issues. Not forgetting development of a large-scale testing programme for the island, including new testing sites, equipment, technology and staff, as well as a tracing function to track and trace cases of the virus and to control the spread in the island. We are continuing to plan, and there's been significant collaboration from colleagues across health, policy and environment teams for a safe exit from lockdown. Relieving these pressures was crucial to securing sustainable funding for health initiatives that will protect and support islanders and their families well into the future. Our primary concern as we move forward is to support islanders to live healthier, active and longer lives during and after this pandemic. Thank you and stay safe.
I am extremely proud of the work conducted by the Justice and Home Affairs Department, which has involved being part of leading the island's response to the COVID-19 pandemic at both strategic and tactical levels. Throughout this period, paramedics, firefighters, the Jersey Field Squadron, police, customs and immigration, prison and health and safety officers have cared, safeguarded, protected and enforced on the front line each and every day. This work has involved a multi-agency approach in order to keep Jersey safe through stay-at-home enforcement, ensuring resilience within our ambulance service to deal with increased demand, management of the essential travel program, emergency planning, island-wide supply of personal protection equipment, workplace compliance, swabbing teams, safety measures within the prison, setting up and managing the COVID testing centres and keeping our borders protected. The department has also continued business as usual. For example, developing the new domestic abuse law, which will be brought before the State's Assembly early next year, and increasing funding for the SARC to support victims of sexual abuse. We are attempting to reform the way in which tasers are authorised and deployed by the police. Feasibility studies have been undertaken regarding a future combined fire and ambulance station, and there is progression on electronic patient records for the ambulance service. Redevelopment of the prison is continuing, and there is a greater focus on rehabilitation of offenders. We've launched the new Jersey variant British passport, and preparations are ongoing concerning Brexit and the island's future immigration strategy. I have maintained my focus on supporting the emergency services and all frontline staff who often put themselves in danger, go the extra mile and deal with the most difficult and challenging situations, all to protect islanders and to ensure Jersey is a safe place to live, work and visit.